Thank you for joining us today for Focusing Evaluation Design. My name is Julie Loughran. I'm a project coordinator here at the Urban Indian Health Institute. I'm working on the Promoting Health Equity for Urban American Indians and Alaska Natives project. I received my master's in public health with a focus on community-oriented public health practice from the University of Washington. During this webinar, we will be briefly reviewing logic models, then spend time looking at different types of evaluation and considerations when deciding to focus an evaluation. This webinar will be recorded and archived on our project website for future viewing. The objectives of this session are to provide an overview of the CDC evaluation framework and the purposes of evaluation, briefly review logic models and their components, introduce two primary types of evaluation, examine what makes a good evaluation question, and discuss how to identify indicators to measure in an evaluation. I will present for about half an hour, and then we'll open up the line for questions and comments at the end of the webinar. So please write your questions down as we go along or submit them using the chat feature on the right-hand side of your screen. When you close out of this webinar at the end, an evaluation survey will appear on your screen. I would greatly appreciate it if everyone could complete that survey, as it is important for helping to improve future webinars and to understand what worked and what didn't. For those of you who joined us for the webinar, Developing Logic Models for Program Design and Implementation, this will be a bit of a review. But before we get into types of evaluations and developing evaluation questions, it'll be helpful for us to have a common definition of evaluation and understanding of its uses. Evaluation is a systematic way of collecting information about the characteristics, activities, products, and outcomes of a program to make judgments, make improvements, inform decisions, and improve understanding. Evaluation can answer questions that seem pretty basic, like what are we doing or what happened, what difference does it make or what did we accomplish, and now what are we going to do? There are many uses of evaluation, such as program improvement, improved accountability, grant writing or fundraising, informing policy and resource allocation decisions, planning and public relations, describing the program and its impact, or meeting program requirements. During this webinar, we will focus more on how the audience for the findings and how the findings will be used will determine the types of questions your evaluation asks. The Centers for Disease Control and Prevention developed the following framework for planning and conducting evaluations. Step 1 is to engage stakeholders. Step 2 is to describe the program. Step 3 is to focus the evaluation design. Step 4 is to gather credible evidence. Step 5 is to justify your conclusions. And step 6 is to ensure use and share the lessons learned. All of these steps are necessary for a useful evaluation. It's an ongoing learning cycle. Today, we're going to focus on step 3, focusing the evaluation design, by discussing the primary types of evaluation, the audience for the findings, and the elements of a good evaluation question. By step 3, we've already clearly defined the different aspects of our program and have an understanding of what each element is intended to achieve based on the logic model we developed to describe our program in step 2. In step 3, we will identify the type of evaluation we want to conduct and develop questions to help us understand if the program is working, why or why not it's working, and measure specific indicators that are appropriate and relevant. To quickly review, a logic model is simply a visual way to present and share how our program is expected to work. Logic models can clarify each element of a program while making explicit the relationships between the resources we invest, the activities we do, and the results we expect. On this slide, you see all the components of a logic model. Each component of the logic model on this slide contains a prompt that helps identify the type of information to include in that section. On the left is our planned work, what resources we put in, what activities we will conduct, and who will participate. On the right is what we intend to occur as a result of our work. The left and right sides of the logic model, our planned work and our intended outcomes, can also be used to differentiate two primary types or categories of evaluation. On the left with our planned work is implementation or process evaluation. On the right with our intended outcomes is outcomes evaluation. If we are examining an indicator that can be found in the logic model component on the left, for example, satisfaction of participants, this would be an implementation or a process evaluation. Before we take a closer look at these types of evaluations, let's think through some aspects of our program and our needs that will help us decide what type of evaluation to conduct. There are a number of factors to consider that will help you determine what type of evaluation will be most useful and most feasible. The age of the program is important because a new program lends itself better to implementation questions, while mature programs warrant impact or outcome evaluations. It takes time to achieve outcomes, and in the early stages of a program, it's helpful to examine how the reality of implementing a program is differing from what was planned. Funding and budget. You may choose questions based on your financial ability to answer them. In many cases, evaluators are accountable to their funders, and that accountability may dictate which questions are chosen. We may only be able to ask questions that funders are willing to pay for, or we may only be able to ask the questions we are able to afford the process of answering. Logistics. So in addition to financial resources, you need to consider the expertise and time you have available to ask questions and to ask questions that you can answer within those parameters. In addition to these kind of practical considerations, there are also conceptual considerations, knowledge and values. We may choose questions regarding on what is known about the cause and effect relationship and the desirability of outcomes. So for example, if the approach we're taking to a problem is new or disputed, we might choose questions about the approach's underlying assumptions. If the approach is widely accepted, we might focus on the impact. If there's little known about how a particular outcome comes about, a process evaluation may be beneficial. For a specific example, it's widely accepted that smoking cessation reduces the risk of lung cancer. Therefore, we might focus our efforts on evaluating a smoking cessation program according to its process, rather than whether quitting smoking had resulted in reduced risk of lung cancer among the participants. Consensus. We may want to choose a question that all major stakeholders, such as program staff, funders, community members, participants, can come to agreement on. And influence. The answers to some evaluation questions may have more power to sway the beliefs, attitudes, and behaviors of those in power. Therefore, we might choose questions based on their ability to influence funding, expansion, or operations. There may be conflicting agendas and more questions to ask and answer than there are time and resources. It's your responsibility as an evaluator to ask the most critical questions, and also questions about equity and disparities, like, for what groups does this program work? So now that we have these considerations in mind, let's look more at implementation and outcomes evaluations. Implementation evaluation activities enhance the likelihood of success by providing indications of what happened and why during the process of conducting the planned activities. As we all know, things don't always go according to plan, and process evaluations can help determine the impact of how a program was implemented in reality. Successful implementation of new project activities typically involves the process of adapting the ideal plan to local conditions, organizational dynamics, and programmatic uncertainties. This process is often bumpy, and in the end, actual programs and services often look different from the original plans. Even well-planned projects need to be fine-tuned in the first months of operation, and often information needs to be continually analyzed to make improvements along the way. Implementation evaluations focus on examining the core activities undertaken to achieve project goals and intended outcomes. Questions asked as part of an implementation evaluation may include, what are the critical components, activities of this program, both explicit and implicit, that allow for participation? What aspects of the implementation process are facilitating success or acting as a stumbling block for the project? Examples of questions that may help you identify areas to monitor could include, which project operations work, which aren't working, why and why not? What project settings, such as facilities, scheduling of events, location, group size, transportation arrangements, etc., appear to be most appropriate and useful for meeting the needs of clients? What strategies have been successful in encouraging client participation and involvement? Which have been unsuccessful? Which project components are most important to project success? Answering questions like these can help determine what changes need to be made so the program can succeed. This type of evaluation provides information that project staff can use as ongoing feedback to help them recognize which activities are working and which activities need modification or restructuring. Examples of this include identifying and maximizing strengths in service delivery, identifying and minimizing barriers to implementing activities, determining if project goals match target population needs, assessing whether available resources can sustain project activities, measuring the performance and perceptions of staff, and measuring the community's perceptions of the project, determining the nature of interactions between staff and clients, ascertaining the quality of services provided by the project, documenting systematic change, monitoring clients and other stakeholders' experiences with the project and their satisfaction with and utilization of project services. Now let's move over to the right side of our logic model with outcomes. Outcome evaluation is another important feature of a comprehensive evaluation plan. It assesses the short and long-term results of a project and seeks to measure the changes brought about by the project. Outcome evaluation questions ask, what impact is the project having on its clients, its staff, its umbrella organization, and its community? What unexpected impacts has the project had? Because projects often produce outcomes that are not listed as goals in the original proposal, and because efforts at prevention, particularly in complex, comprehensive, community-based initiatives, can be especially difficult to measure, it's important to remain flexible when conducting an outcome evaluation. Quality evaluations examine outcomes at multiple levels of the project, including individual client-focused outcomes, program, broader family or community outcomes, organizational outcomes, and systems-level outcomes. Evaluations can focus not only on the ultimate outcome expected, but also attempt to discover important interim outcomes or unexpected, unanticipated impacts. An outcome evaluation can serve an important role during each phase of a project's development. Early on, you might want to focus an evaluation, outcome evaluation on short or midterm outcomes, such as changes in knowledge, attitudes, skills, or behaviors, so things that could happen immediately following participation. Thinking through how individual participant outcomes connect to the specific program or system levels outcomes. These type of early evaluation activities increase the likelihood that implementation activities are linked to the outcomes so that you can really tie directly the activities you're doing to the changes that you're seeing. It can also help staff and stakeholders stay focused on what changes you are really attempting to make in the participants' lives. In later phases of project maturity, an effective outcome evaluation is critical to demonstrating the effectiveness of your project and making a case for its continued funding or for expansion or replication by showing long-term outcomes. So long-term outcomes are things such as changes in disease status, in the environment, in policies or systems. Helping to answer questions about what works for whom and in what circumstances is also a benefit of these later outcome evaluations, as well as linking which implementation activities and contextual factors are supporting or hindering outcomes and overall program effectiveness. Now that we've been introduced to implementation and outcomes evaluation, as well as things to consider when deciding which type of evaluation to conduct, let's turn our attention more to developing the actual questions our evaluation will seek to answer. Carefully designing and choosing the evaluation questions is critical because what we ask and how we ask it will determine the answers we receive. There is no perfect evaluation question that will answer everything that we may want to know about a program, but a good evaluation question can give us better knowledge and provide a foundation to build on for future activities. There are three components we need to be able to identify before we can develop our evaluation questions. The first is what specifically we're evaluating. The second is why we are evaluating it. And thirdly, what we hope to accomplish with the evaluation results. Being able to complete this sentence is a good way to get started. For example, we are conducting an evaluation of our depression support group program because we want to know if clients' depressive symptoms change with participation in order to report program outcomes to our funder. Another example is we are conducting an evaluation of our program support group program, our depression support group program, because we want to know the extent to which clients implement coping strategies in order to determine if the support group is an effective approach to teach and motivate participants to self-manage depression. Sometimes our evaluations come from models or findings of experts in the field, professional standards, guidelines or checklists, or funding stipulations. Questions should be informed by who needs to know what, but can also be informed by the project director, project staff and volunteers, project clients, boards of directors or leadership, community leaders, collaborating organizations, the project proposal or other documents, relevant literature or expert consultants, or similar programs in other organizations. Different stakeholders have different priorities and therefore different questions, and there's inherent judgment and value in the questions asked. For example, while some argue that medications result in decreased symptoms of depression, the desired outcomes, others may argue that poverty reduction programs would be much more effective at reducing rates of depression. The debate revolves around our clinical understanding of depression, our grasp of the social determinants of health, as well as our worldview. That is to say, the theories of cause and effect relating to various health outcomes and behaviors are widely disputed and also carry heavy political weight. Understanding a program's theory through the logic model or another mean is therefore an important first step in developing evaluation questions because a program's success or failure depends on its underlying assumptions of cause, effect, and implementation. On this slide, you can see a table of a stakeholder in the who column, what type of thing they may want to know, and how they would use information. And so these are the categories that will help drive the development of the evaluation question. So now let's talk about specific characteristics of a good evaluation question. Evaluation questions should be relevant to the expectation of stakeholders and domains in which the intervention or program can realistically hope to impact. Questions like, is our depression support group increasing the state reimbursement rates for mental health services are not appropriate or relevant because the depression support group cannot reasonably be expected to impact state policy. A more appropriate and relevant question may be, how have clients' perception of the emotional and social support they have changed over the course of their participation in the program? You can see that this is much more focused on the actual support group and a realm in which it could reasonably be expected to affect. Another characteristic of a good evaluation question is that it is answerable. Can the questions be answered given the program? Here it is helpful to be specific. For example, what if the question were to ask, are program participants doing better than before? This may sound reasonable, but it's vague and doesn't have clear indicators of what to measure in data collection. This question could be interpreted as, are participants earning more money or having fewer run-ins with the law? The question must also indicate some observable, tangible evidence that can be realistically obtained. So this question can be rewritten to state, compared to the beginning of the program, how have participants' depressive symptoms changed? This question is still related to an improvement, but indicates a specific aspect of doing better that can be measured. Additionally, we don't want to ask questions that can be answered yes or no, like are participants doing better than before? Someone could say yes, someone could say no. But that doesn't leave room for describing other possibilities, like that a program made a matter worse compared to the baseline, or that the goal was just barely missed. So while we want to use specific performance measures for quantitative evaluation components, we don't want to specify the direction of change in the question itself. Finally, we will want to be able to actually gather the evidence to answer the question with the resources and timeline available. So for example, does exposure to physical violence cause depression? Answering this question, determining a cause for depression, would be an extremely expensive, time-consuming, and scientifically rigorous project. We can collect information on how many people in our support group have experienced personal violence and symptoms of post-traumatic stress, but would not be able to actually prove a causal relationship. Instead, we may want to ask, at the end of program participation, how does the implementation of stress coping skills differ between participants with a history of exposure to violence and those without a history of exposure to violence? In summary, we want evaluation questions that are relevant to the program, specific, measurable, answerable, and reasonable to collect. Once we have a list of all the possible evaluation questions we would like answered, we must ask ourselves, are the questions truly important? Will the answers to these questions provide new insights? And which of these questions do I want to know, and which do I need to know? As an evaluator, you have to prioritize the questions that need to be answered to meet the purpose of the evaluation. During step 2 of the CDC evaluation framework, describe your program, you identify the program's specific objectives. Much of the time, the criteria for evaluating the outcomes or impacts of a program come from the program's objectives. Each objective should be an action statement that includes one purpose and one end result stated smartly. So briefly, SMART stands for specific, measurable, attainable, relevant, and time-bound. As evaluators, we must translate our theory of relationships, objectives, and/or outcomes from our logic model into questions. The questions give direction to the evaluation not only by playing a key role in determining what you want to learn, but also how the evaluation will be conducted, since some questions are best answered with numbers that can be collected through logs and surveys, and other questions require more detailed information from interviews or focus groups. Ideally, you have some quantitative information and some qualitative information to tell a complete story. So let's look at some examples. An objective from a suicide prevention program may be to facilitate 12 depression self-management workshops using a culturally adapted version of an evidence-based curriculum during the first year of a program. From this objective, we might get the following implementation evaluation questions. What changes were made to the evidence-based curriculum to make it culturally appropriate? How do these changes affect the implementation of the curriculum? So you can see that this objective would have come from the output section of our logic model, and therefore we get a process or implementation question for an evaluation. Another example using an outcome objective, which would come from the right side of our logic model. So this outcome objective example is, after participation in 3 or more sessions, 60% of attendees will report implementing 2 steps they took to self-manage their depressive symptoms. From this outcome, we might get the following outcome evaluation questions. What percentage of participants who attended 3 or more sessions reported self-management actions? What was different between those who did and those who did not? Just like objectives, each question should only address one component and must be answerable. Remember, questions that can be answered with a yes or no will not give us a complete picture of the events and outcomes. So we want to develop a comprehensive list of the questions we could ask, then take time to review and organize the questions. Once you have a comprehensive list, you can continue to work with stakeholders to select a few key evaluation questions to be included in your evaluation by considering what is essential to know, what resources are available, who is using it or the audience for the findings, and how you can obtain the answers to the questions, and why you need those answers. Now that we have our evaluation questions, we need to collect the evidence required to answer them, which is where indicators come in. An indicator of fire is smoke, or an indicator of understanding math could be correct answers on a test. In program evaluation, indicators are tangible things that we can see, hear, or read that demonstrate the outcome. Once we develop a specific evaluation question, we need to identify an appropriate indicator to measure in order to answer that question. The indicators we decide to measure in our evaluation will determine our evaluation methods. For example, if we want to gather information on the short-term outcome of increased knowledge, we may want to conduct a pre-intervention quiz and the same quiz again at the end of the intervention to show a change in knowledge. But if we wanted to gather more in-depth information about the reasons participants chose to attend sessions or barriers to their attendance, we may want to conduct interviews. In this table, you can see the part of the logic model, the type of evaluation it falls under, some examples of questions that may be asked in that component of the logic model and evaluation type, as well as some examples of indicators that you could measure. So in summary, in developing evaluation questions, we want to consider who needs to know and what they need to know, as well as the theory and age of our program. But we also need to limit our questions to those we can reasonably collect information to answer. The questions we choose to ask drives the indicators we examine, how we collect the data, and ultimately the information we receive, which in turn drives our actions. So I'm going to go ahead and open up the line for questions now. UIHI staff are also offering individualized technical assistance on designing logic models for staff at urban Indian health organizations. And you can contact me, Julie Loughran, to find out more about this free service. I can be reached at area code 206-812-3042 or by email at juliel@uihi.org. And here are some additional resources for and links to resources that provide templates, checklists, and guides for developing logic models and planning evaluations. Our next webinar will focus on the next step of the CDC evaluation framework, gathering credible evidence, and look more at identifying the appropriate data collection techniques for chosen indicators and evaluation questions. If you would like to receive future webinar announcements or other UIHI-related resources and updates, please join our listserv by going to our website and selecting the subscribe menu option. You can also view this and other webinars archived on our website at www.uihi.org. And please do take a few minutes to complete the survey that will appear on your screen to help us improve future webinars. Thank you so much for joining us.